In the phase 2 CLIA Venetoclax trial, we enrolled younger, fit patients with newly diagnosed AML or high-risk MDS to receive intensive chemotherapy with Venetoclax. The intensive chemotherapy backbone was CLIA, which was Cladribine 5 milligrams per meter squared for 5 days, Idarubicin 8 to 10 milligrams per meter squared for 3 days, and Cytarabine 1 to 1.5 grams per meter squared for 5 days, in combination with the BCL2 inhibitor Venetoclax 400 milligrams per day for 7 days, which we adjusted accordingly for antifungal prophylaxis. In the consolidation cycles, we reduced the dose and duration of chemotherapy. We gave Cladribine and Cytarabine for 3 days, Idarubicin for 2 days, and we kept the Venetoclax at 400 milligrams for 7 days. In the updated analysis, we treated 89 patients with AML and 7 patients with MDS. The median age was 49 years, reflecting a younger cohort, and most patients with AML were ELN 2022 adverse risk. The composite complete remission rate among patients with AML was 94%. The rate of MRD negativity by multiparameter flow cytometry among patients in remission was 89%. The overall response rate among the ELN 2022 risk categories was 100% for favorable risk, 96% for intermediate risk, and 92% for adverse risk AML. So next we look at the molecular categories, and among 30 patients with NPM1 mutated AML, the overall response rate was 100%. And among 12 patients with KMT2A rearrangements, the overall response rate was 100%. And lastly, in 7 patients with high-risk MDS, the overall response rate was also 100%. So patients received a median of 2 cycles of therapy, and nearly 70% of patients with AML underwent stem cell transplant. So this approach translated to an outstanding overall survival in AML and MDS. In patients with AML, the 2-year overall survival was 75%, and the 5-year overall survival was 73%. In patients with MDS, the 2 and 5-year overall survival was 100%. So taken together, the composite complete remission rate of CLIA Venetoclax in AML was 94%, with the majority, about 90% of patients attaining an MRD negative response. And these very high response rates facilitated most patients to transplant, and low relapse rates after transplant translated to an exceptional 5-year overall survival rates. So CLIA Venetoclax appears to be a highly effective curative regimen that produces deep and durable remissions for AML and for high-risk MDS.